Hello. This presentation will be an adapted version of the TeamSTEPPS Fundamentals course. The intention of this training is to provide learners with information that can be used to guide interprofessional groups through the process of discussing and planning the care of older adults. This is not meant to replace the traditional Fundamentals TeamSTEPPS course, but to offer a version that learners can use to apply in clinical situations that occur away from the bedside, such as in patient planning. These are the objectives for this recording, and that is to recognize the benefits of teamwork in the process of interprofessional care of older adults, to identify the key components of teamwork that can be used in practice when planning, implementing, and evaluating care of the older adult, to describe strategies and tools of communication that can be used to reinforce interprofessional teamwork, and then to apply these strategies of communication, leadership, situation monitoring, and mutual support in an interprofessional team when planning the care of the older adult. So as you can tell, we are interested in your using teamwork for the care of the geriatric patient. That is not to say that these cannot be applied to different populations, but it is the purpose of this particular training.
Here's another fact check. Members of a healthcare team don't always have the same goal, but may function independently towards their own goal as long as they have the best interest of the patient in mind. Is that true or is that false? Advance the slide and find out the correct answer. That statement was false. A team is defined by Katzenbach and Smith as a group of people with complementary skills but who are committed to a common purpose, performance, goals, or approach to hold themselves mutually accountable for. So we cannot go around in a team with different goals in mind, but rather need to work together as one. You may have heard of the report To Err is Human that was released by the Institute of Medicine in 1999, which stated there were 100,000 patients who died each year in the hospital from medical errors, and that 72% resulted from communication errors. In that statement that's highlighted, people make fewer errors when they work in teams, has been established and supported in the research, which found this relationship is true and that in fact good team training can lead to a 50% drop in adverse rates, 50% decrease in length of stay, post-op sepsis rates have decreased, and clinical error rates have decreased dramatically. A 100,000 lives is not quite as many who showed up in Cleveland when LeBron brought his championship back. But it is a lot of people, and we can do better in healthcare by lowering medical errors. Here's another fact check for you. The number of medical error has not significantly decreased over time despite efforts to do so. Is that true or is that false? That statement is true. The number of medical error has not significantly decreased over time, despite our efforts to do so. So even though we have made some improvements in things such as infection rates or adverse rates or lengths of stay, we still have a high number of medical errors that cause death in our patients. And it is currently, in 2016, the number 3 cause of death in the United States. Interprofessional collaborative practice is considered the gold standard for healthcare in the United States. This report was released in 2011 and recently updated in 2016 that identified 4 major areas that make up this gold standard: values and ethics, roles and responsibilities, interprofessional communication, and teams and teamwork. Together, the founders recognize that IPCP in healthcare can improve safety and raise the quality level of patient-centered care. moving towards the triple aim of improved patient experience with healthcare, care directed towards populations, and care that is delivered at a lower cost. Rather than go through each of these domains that make up interprofessional collaborative practice, what I've done with this slide is gave you some common teamwork functions on the right-hand side to match up with those competencies on the left. So take a look at some of those teamwork functions or activities and see if you can figure out which domain it belongs to. Go to the next slide to find out if your answers are correct. This is a matching exercise with the answers to it from the previous slide. In that first question, the discussion of patient wishes for discharge, that's a perfect example of using value and ethics as well as interprofessional communication in a team function. Requesting a consult with another profession, that would again be an interprofessional communication because you're talking to another person, but it also involves knowledge of roles and responsibilities, which is the second domain. Explaining the perspectives of your profession in a team meeting is using the same two, roles and responsibilities, making sure you understand and that they understand your role, communicating your role is part of that domain, as well as, of course, communication, which is the third domain. The fourth item, dividing the work of the team members among those members, is an example of teams and teamwork. So dividing up the small jobs and making sure everyone contributes, that is all part of that teams and teamwork domain. And number 5, expressing appreciation for the viewpoint of another team members involves value and ethics because valuing one another falls under that domain. And expressing appreciation is another way that we can do that. And then, of course, that also entails interprofessional communication in that particular activity. And number 6, articulating new developments in the patient during a team meeting. That's a perfect example of using interprofessional communication and sharing the knowledge that you have. And number 7, forming a subcommittee group to accomplish team goals is another example of a team activity that falls under Teams and Teamwork domain of IPCP. And finally, number 8, developing a trusting relationship with other members of the healthcare team, including the patient and the client, is a great example of value and ethics. Remember, the patient is part of the team as well.
So TeamSTEPPS is a model of teamwork, and this is the visual model. It is an evidence-based framework that's used to optimize team performance across the healthcare delivery system. This model represents major components of TeamSTEPPS, and you can see at the core the concepts of leadership, communication, situation monitoring, and mutual support. All are surrounded by the patient care team, of which the patient is a part of. And each of these will be described according to knowledge, skills, and attitudes, the different types of learning domains.
In TeamSTEPPS, what you will be doing is developing your knowledge, skills, and attitudes related to team performance. We will help you understand what it is you need to know about team performance, how to apply it in skills, and also how to develop a more positive attitude about the value of teamwork. Something that we've learned about teamwork is that team skills are not innate, they must be learned, and therefore learning them and reinforcing them over time is the best way to be the best type of team member and team leader even. So even if you've had team training before, consider these next several slides as a refresher to help you be a better team member.
So let's begin with team structure. The team structure is really about who is part of the team. Do we have the right individuals gathered together? And as an attitude, do we think more of a we rather than an I? And that's the best indicator of the development of a team.
Team structure fact check. A team can only function effectively if all team members are physically present for an in-person meeting. Is that true or is that false? The answer is false. While it is ideal to have everybody physically present, There are still other creative ways to be an effective team member even if you can't be there, like calling in or sending in a detailed report. Fact check, team structure. Team leaders or team members are responsible to know the roles and responsibilities of other members. Therefore, anyone can request a new member join the team. That is true. Gathering the right team members for a patient-centered goal is something that is included in team structure domain. Can you think of a time when you worked in a group to accomplish a common goal and thought, we could use a different person here. We need someone with a different skill set than who is gathered. By inviting that person to your team and including them because of their specific skill set is an important part of teamwork. This is an exercise for seeing if you know how to use team structure well. Are the right team members here for Betty? Betty is an elderly woman who has early onset Alzheimer's. She doesn't always remember to eat, and she has type 2 diabetes. Her primary care physician has asked her family and home health care agency nurse to meet to discuss how to keep Betty safe at home. So who else do you think should be asked to participate in the discussion? Think for a minute. Who else should be here? Did you think of nutrition, who could come to help and give insight into some of the best foods that would help Betty? Or an endocrinologist, physician, who could add information regarding diabetes care? Did you think of a pharmacist who would help with the medications? How about a social worker who could help with other resources for home respite? And what about speech therapy? Did you think about them? They could lend assistance regarding neurological functioning. How many of these did you guess correctly? Partnering with a patient should not be overlooked either. Remember, they too are valuable members of their own healthcare team. So remember, just because they're elderly doesn't mean they are less capable of being involved in their own care. So Betty should have been listed in that team gathering as well. Let's take a look at the next TeamSTEPPS domain, team leadership. Check. There can only be one leader in a team. Is that true or is that false? Click the button when you're ready. The correct answer is false. There can be more than one leader, and the leadership should be situational, not by hierarchy. Another leadership fact check. Teams with leaders are more effective than teams without leaders. Is that true or is that false? Click the button to find out the answer. That is true. Without leadership, a team flounders to find direction and move efficiently through the work of a team. While leadership can change to different people at different points in the work of the team, good leadership is essential to good teamwork. Everyone knows what a leader does in a team, and these statements just clarify what the leader's responsibilities are when they're being carried out correctly. Notice that communication is a noted priority for the leader to use at the beginning of the team process, but equally important to provide continued review and updates for the team, and also gathering them together at the end of team processes. The type of leader can use communication to foster a culture of teamwork and mutual support of one another as well. Leadership does not have to be the person with authority and rank, but rather should be dictated by the situation or activity at hand, and then the best leader for that purpose should be chosen or should volunteer. Leaders are needed to give the team direction, to ensure all members are being utilized to their fullest extent, that timelines are met, and that resources are available or requested when they are not. So what this quote shows, in the past a leader was a boss. Today's leaders must be partners with their people. They can no longer lead solely based on positional power. One communication strategy that can be used by leaders is a brief. And when we use a brief, it is at the beginning of the process for a team. It would be similar to what we use in the clinical setting as a shift report, finding out what overall goals and treatments or individuals are part of that day. So in a team meeting example, it would be, for example, the first meeting where we gather groups together of individuals and we discuss what the shared vision is. Do we have the same mental model about what needs to happen, who's on the team and what their responsibilities are, and where do we go from here? Second type of communication tool is called a huddle. This is something that happens throughout or in the middle of a process for a team that brings them back together to touch base and to figure out what's going on so that everyone has situation awareness of what the other team members are accomplishing or having trouble with, so that there might be some readjustment to the plan. And finally, the third type of communication strategy that can be used by a leader is a debrief, and this is at the end of a teamwork process. This is when something has already been completed and we bring our team back together to say, okay, what went well, what didn't go well, what should we change next time? So debriefs are used in order to allow people to give their input about what they feel could have gone better for future quality improvement. Now we're going to move on to the next type of domain under TeamSTEPPS, and that is communication. Here's a communication fact check. There are national initiatives that direct healthcare providers to communicate better with one another to reduce medical error. Is that true or is that false? Click the button now to find out. That is true. There are national initiatives that help us and direct us to do better with our communication because that is found to be the root cause for most medical error. In fact, the Joint Commission found that communication was responsible for 66% of all sentinel events, and it became one of the national patient safety goals related to communication. In order to get better at communication, we know that we need to practice and we need to learn better about how to communicate with one another. Encouraging the active involvement of patients is another important communication strategy that has also been related to improving patient safety. Exchange strategies, such as these on the screen, have all been identified for improving communication among interprofessional team members. SBAR, handoffs, checkbacks, and callouts are all ways of communicating with one another. Here's a communication fact check. SBAR communication can only be used for relaying information in a clinical setting. Is that true or is that false? Click the button now to get the correct answer to this question. Of course, that is false. It is not only used in clinical settings, but we can use SBAR in our everyday communication. I've even found it useful for starting my emails and thinking about the SBAR communication. Remember that SBAR stands for the situation, the background, your assessment, and recommendation. When we use SBAR, what we're doing is we're starting out with the reason that we need to communicate something. That's the situation. Here's what's going on from my perspective. The background includes details that are relevant to the problem. The assessment is what I think the problem is in a nutshell. And the recommendation is how I suggest we resolve the problem. So all of that put into that type of format can help us to remember effective ways of communication. Here is a communication fact check matching exercise. Callouts, checkbacks, and handoffs are the three other types of communication skills that are used in TeamSTEPPS. Here's some examples that maybe you can figure out which one goes where. In the example of Betty missed 4 meals in the past 3 days and her blood sugar was low this morning, that's an example of what? Click the button to find out now. That's an example of a call-out. Correct. Calling out is just letting people know what it is you know and you want to share. And the second one, if you say, I've managed Betty's medications, but I would like the pharmacist to recommend what would be best for her at this time, is that an example of a check back or a handoff? Click the button now to find out what the correct answer is. If you guessed handoff, you were correct. A handoff is transferring your responsibility to someone else. So you're talking about how you've dealt with Betty's medications and that you want to hand off that responsibility to the pharmacist. In the third quotation, if you say, I heard you say that Betty gets confused in the evening. Does this happen every night? You guessed it. That is an example of a check back. Go ahead and click to reveal the number 2. Check back is a closed loop communication. So that's saying what you heard from another team member and then sending it back with another question or a follow-up, like, does this happen every night? Such as callouts, checkbacks, and handoffs can be incorporated into your everyday care or even in team meetings, such as you will have with these simulations that will follow this training. Now we're going to move on to situation monitoring. Here's a situation monitoring fact check. Situation monitoring in teamwork is a constant state of awareness of team members regarding the work of the team. It does not change over time if the members do not change. Is that a true or a false statement? Click the button now to reveal the correct answer. If you guessed false, you were right. That is false because it does change, even if members do not. Situation monitoring is actually a continuous process that begins with the individual skill of situation monitoring and builds to a situation awareness, which is another individual level. So just being aware of what's going on around you and among your other team members is the first thing that needs to happen. So not just being in your own silo or your own little bubble, but also being aware of the team's work overall. That can lead then to a shared mental model, which is the team outcome that we're working towards. So, situation awareness is the state of knowing that the current conditions affecting the team's work and maintaining the mindfulness of what others are doing. Knowing the status of a particular event or what the team's tasks are and who's doing them, and just knowing operational issues can help you become more situation aware. The shared mental model is just what it sounds like. Everybody has the same idea, and teams that perform well hold shared mental models. Here's something that you can think about and demonstrates a lack of a shared mental model. Take a moment and think of a time in your patient care experiences when there was a lack of a shared mental model. Were different team members of a healthcare team trying to move the patient towards a different goal? Was there a situation where you had family members who were not on the same page as what the healthcare team thought? Or did you have a patient who wanted something different than what was being planned? That would be some common things that happen in the clinical setting where you don't have a shared mental model. Well, here, meet Beatrice. Beatrice was a 98-year-old woman who had been mentally active her whole life. Recently, Beatrice began experiencing difficulty swallowing and had lost approximately 10 pounds over 6 weeks. She lived at home with her daughter, who asked the team to meet with her to discuss care options for her mom. The different opinions that may have included the surgeon who said, let's schedule an invasive procedure to aggressively treat the underlying problem of Beatrice's not being able to swallow. The dietitian may have said, let's change the diet to one that the patient may be better able to tolerate. Or the nurse who may have said, let's prepare the patient for end-of-life care as the patient continues to deteriorate. While each of these are possible scenarios or ways of treating Beatrice at that time, If they all sat and didn't communicate with one another, they would not share a shared mental model. Remember, shared mental models are a goal, not an assumption. Now let's discuss mutual support. Mutual support consists of assisting one another, providing and receiving feedback, and exerting assertive and advocacy behaviors when patient safety is threatened. These are just some of the concepts that are incorporated into this particular domain of TeamSTEPPS. Support fact check. Good team members complete an assigned task regardless of the pressure or difficulty without asking for assistance. Is that true or false? Go ahead and click the button now to reveal the correct answer. If you guessed false, you were correct. Asking for assistance does not make you a bad team member. It is in fact something that you should do if you find that you are unable to complete a task, because it's not just about what you can do, but what the team collectively can do. So when it comes to task assistance, team members can foster a climate where it's expected that assistance will be actively sought and offered as a method for meeting the team goals and reducing the occurrence of error. Think about it in the situation of a team meeting. Sometimes one member gets overwhelmed with the goals that they have taken on, and so it would be to the benefit of reaching that goal in a timely manner if they were able to speak out and say, I really need help with a certain task that I've taken on, if they know that other members are less heavily involved. So mutual support is acting on situational awareness of what a team needs and makes for effective teamwork. To use mutual support in a team meeting example, remember that communication strategies can be used for offering assistance. You should be specific, be respectful, and provide a timeline. So take this example. You're in a team meeting and one member has numerous responsibilities to follow up on for a patient plan of care for discharge. The team leader, let's say it's Mary in this example, offered to meet with the family, contact the chaplain, and consult social work for available community services. You do not have any responsibilities to bring back to the team since your reports were finalized. So how do you respond in this situation? And how do you do it? Here's an example of what you might say using these guidelines. Mary, I have time this afternoon and will contact the patient's chaplain for you. I have time since my work for the team has been completed. So in this way, you have been specific about what you're willing to do for Mary. You've been respectful of her rather than saying, I see that you are completely overwhelmed, for example. And you also provided a timeline. I'm willing to do this at this time. And that way it can be very helpful because it also shows that you have situation awareness, that you're aware of what is going on with Mary, and you also are being an effective team member by helping move towards the shared goal of getting a patient towards discharge. There are characteristics of effective feedback, and that is that it's timely, respectful, specific, directed towards improvement, considerate, and helps prevent a problem from occurring in the future. Giving effective feedback might be something you do as a team member, whether it be in a clinical setting or in a team meeting setting. Sometimes we just need ways of hearing that we've done well, or that we know that someone has tried their hardest, but there are ways to get better in the future. And so it's important not to take any criticism in a way that is personal, but also if you're giving that feedback, to make sure that you are being respectful of that person's efforts and feelings.
Great. I'm Carrie Feldman, Mrs. Everett's daughter. Hi, I just wanted to say you did a great job with the heads up on Miss Everett the other night. Amy said she might not have realized Eddie was getting so sick if you hadn't spoken up.
Sure thing, thanks.
Amy mentioned there's a nurse managers meeting next week. I thought what you did would be a great example of effective communication and teamwork to spread across our units here. Would you mind talking to the group about what you did?
Not at all, Dr. Feldman.
That was a great example of giving feedback. Another type of communication strategy that you might need to use is what's called a two-challenge rule. And this is one form of communication that you can use in a respectful way when there's a difference of opinion with another team member. A two-challenge rule is where you restate for a second time a concern that you have with a decision that has been made, whether it be for a patient or just in a team meeting for a direction for what the team should do. By restating it in a different way with some supporting evidence, that's how a two-challenge rule is used. Another way might be a second person, whether it be a separate team member, joins in or is consulted for their opinion on what decision should be made at that point in time. The acronym CUS stands for I am concerned, I am uncomfortable, or this is a safety issue. This is a communication strategy that can be used for giving feedback to an individual on your team who you may have a difference of opinion with. Starting your sentence with I am concerned about that decision or I am uncomfortable is a respectful way of verbalizing your difference of opinion. Saying this could be a safety issue is kind of the final straw on something if it is a clinical decision that you feel would lead to an error or a decision that might make a clinical condition go poorly. Using CUS can be a very effective way of communicating with one another. Let's practice mutual support by using either the two-challenge rule or CUS communication for the following scenario that has to do with George. George is an elderly man who wishes to go home from an extended care facility to his daughter's residence. The team leader on the case makes this statement: George is being unrealistic. He cannot go home, and I am making arrangements to transfer him to another extended care facility that he might like better. How would you voice your disagreement with a two-challenge or a CUS? Finally, let's just pull it all together with a summary. Some take-home facts that we want you to remember. Teamwork strategies and tools are available for team members and team leaders, and they can be applied in most situations, whether they be clinical or in team meeting, team planning type of settings, because they complement one another. For your participation, always try to get better as a team member. We are better together than we are separate.